Welcome back to the episode here on the Hard and Hustle podcast. My next guest, she dropped out of high school, escaped a cult, survived end stage cancer, and still rose to lead one of the most impactful mental health organizations in the country. Janine, welcome.
Thank you so much. I'm excited to talk with you today.
I am too, and I'm so excited to just get right into it. Like you were on your own at 15, where most kids are just figuring out who they are. And what part of you had to grow up overnight? Because I can imagine that it wasn't easy.
I think it just came with the life of having to do a lot for myself. And
Hmm.
so I think even at 15, I was used to it, you know? It seemed natural. And I just had a real drive to be strong and to find safety in the world. That was really a theme to create safety and be strong to to have an impact in the world, frankly.
And Janine, I kind of like you. I wouldn't say I was on my own, but I remember 15 years old, already working at having a job, having to pay for my own cell phone, and it teaches you a lot of different things, right? There are those moments while we're young, we don't get it, but it truly helps us fight. And when did you realize that fighting turned into purpose? Because you had to fight.
I think it I mean, there was many small things, but there was one moment in my life, and actually, it was at the point when I had just finished cancer treatment for a whole year. I was in my late 20s, and I was faced with a decision about where I was going to work. And really, since the end of that treatment, I just felt like I was on fire, that, there were urgent things to do in the world and limited time. And so I
Hmm.
had to make a decision between two jobs. One of them was working as a street outreach worker, going to find people who were living on the street with mental health and drug and alcohol issues, really kind of marginalized from society. And I was so drawn to it one day before I made the decision, going into a shopping center, and I was walking through the parking lot and saw somebody homeless with all their stuff in a cart, really struggling. And to me, it was a total outrage that we allow people to languish and to literally die on our streets in this rich
Hmm.
country, that we couldn't deal with these issues. And that was it. I was just so drawn to it. And I'll tell you, in all my career, that was the most impactful job I ever had as a street outreach worker. Why? Because literally what you realize is the relationship that you form is the
Hmm.
basis for all healing that occurs. There has to be trust for people to want to move along, to have hope, to understand that there is a pathway to recovery, to healing, and that there are people who care and are going to help. Um, so I can remember all the people's names. I mean, we're talking 30 years ago. But
So
yeah.
actually, Janine, you tell that story. Do you feel that after that near-death experience, that was the moment you knew this is why I'm still here, is to really make an impact in my community and help those that are out living this life?
Yeah, I think I realized it then, but while going through the treatment, because it was touch and go and they weren't sure I was going to make it, I had to have extensive treatment. I just remember a time I was in the bone marrow transplant unit in the hospital, sequestered. Back then, they didn't let anyone in for 3 months, and I was looking through a window out into the atrium of the hospital and just had a realization that either I wasn't going to be here on this earth, or if I was, that I knew that God had some big purpose, that He wanted done, and that I would be able to do that. And so after that, I just feel like it's walking in a mission. I so resonate with the work. I never, ever wake up and feel like I have a job. I feel like I get to do this mission, and that I'm going to
Hmm.
make today count. There's not going to be a day that goes by that something great is not happening, on behalf of the mission. And I mean, it's such a blessing. Actually, it turned
Yeah.
into a blessing to have that level of, I call it like a fire, that came into
Mhm.
me.
And you continue to live your life just with this purpose-driven mindset. You even walked away from law school, if I'm not mistaken, and into domestic violence shelters. What called you into the trenches instead of the courtroom?
Yeah, that was really interesting what I learned about myself when I went, because I always knew I wanted to fight for justice,
Yeah.
especially for people who are oppressed. And so that's why I went to law school. But in it, I realized it was very dry and devoued of the human element, the human experience. And I just did not feel that that's where I should be. At the time, I was a rape crisis volunteer, counselor, advocate,
Mhm.
volunteer in Atlantic County Women's Center. And so when I decided not to continue in law school, they offered me a full time job. And I started actually in a shelter. They had a domestic violence shelter, plus, I did counseling on the phone for rape and domestic violence survivors. And then ended up doing a lot of other work, even co facilitating a men's group for people who were abusive. I did that with a male partner. We did that co facilitation and, just learned so much about trauma from many levels and
Mhm.
how that impacts mental health and also how it interferes with stability, with housing. And just at that point, I realized the importance of stable and supportive housing where needed as a foundation for people to do everything they do.
Janine, I'm sitting here and I'm listening to you and the story from, the 20s. I mean, really since the 15s to the 20s. So I can only imagine every decade was something different. It was that moment in your life that's a roller coaster. I always say life is like a roller coaster. And if you don't feel that roller coaster, are you really living, right? But how through all these different things were you able to keep the mindset? We talked about mindset a little early before we even hit record. I think it's so crucial that when you go through, you talk about some of the rape, the hotline and dealing with the rapes and all the stories that you hear. How are you helping the mind stay clear and never taking that story home and making it yours?
In everything I do, no matter how hard, I always see the resilience and the survivorship of people. It's the human spirit. It's like a fire that that
Hmm.
can't be quenched. So it's the resilience that is so inspiring to me. And now in the work I do with mental health partnerships, it's all about that. We take people. Well, we don't take them; they come to us. They have mental health conditions, and they become peer specialists, where they then
Hmm.
are taking their experience and helping others walk along the journey of recovery. So, in all that, I mean, the hope is amazing. Do we see hard things? Yes, we see people struggling with homelessness, not having what they need, but it's hopeful in what we do because we can see the change and that support offers. And I think at the end of the day, I have a larger philosophy of life, realizing that there's a meta story to it, that kind of transcends our day to day, what we see here. So I think philosophically and theologically, the way that I think allows me to continue to be very positive and optimistic, even in the face of a lot of suffering.
And you truly, through it all, have led some powerhouse organizations like the one that you're with today, Mental Health Partnerships. Um, but that transition, what do you remember the transition that really kind of shook you and forced you to lead a little bit differently, the way that you're leading today? What was that moment? Maybe through different organizations, learning from other leaders, a mentor.
Yeah, oh my, everything. I can think of like every year it was something different. And that's the thing when you're a leader, you never stop evolving because you have to respond to what the needs of the organization are. And that is a living thing, an organization. And, largely, I think what I've grown in is relationship. When I was a young leader, I was very focused on tactical things, like getting it done, like this
Hmm.
urgency. And I don't want to say that that's left me. I still have it, but I recognize the importance of relationships at all levels, and the importance of really cultivating people
Hmm.
to be leaders. Because if you're ever
I
going to achieve a bold mission, you need everyone in the org to be leaders. I don't care if they're a facilities person, whatever they're doing, a administrative assistant or a division director. They all need to be leading.
I spoke to a leader yesterday. He's leading an organization where their annual revenue next year will be $720 million,
Wow.
right?
Wow.
And when he took it over, I think it was like 89 million. So there was a huge increase there.
Mm.
So of course I had to pick his brain, like, sir, what are you doing? We all want to get there. And some of the things he mentioned is when he took over the organization, he made sure that the board members that he was bringing on were business professionals. That was one of the tips and tricks he gave me. And then the other one was exactly kind of what you said: is partnerships, is networking, is getting the story out there. Chamber of Commerce, looking at those things in your community that you can be a part of. And I didn't think about it, leading a nonprofit myself, especially taking over. I thought to myself, like, yeah, and yeah, there's a small investment to be a part of these chambers, but the relationships that are really being built there, the community partners that you get to meet. Now, when you have events, you have some of these other leaders that also show up and bring their communities to these events. So I love that you said that, Jeannine, that it's something that you've kind of learned, and it's helped you, because I'm in the space now where it's like, great, I do bring that strategy and those tactical things. But yes, partnership is major. That's how we grow together, because we can only go but so far alone. So
Absolutely.
it's kind of what you said, come together, let's bring ideas to the table, and how do we continue to scale with educating ourselves, right?
Absolutely, and
So
it's
I
so,
love that you
so
brought that.
true for nonprofits, especially, because we're trying to achieve these goals that have never been done, that are, very complicated. So we need to work together to approach it in a holistic manner. And mental health partnerships, like our name, really
Hmm.
embraces that. Partnerships on every level, whether it's with other community-based organizations, with corporations, or with legislators, with our leaders in our city. We believe in partnership at every level.
Hey, real quick, if you enjoying the podcast, we first want to say thank you. And we also just want to give you a little insight of what we're up to at Francis. Some don't even realize that we're working with organizations to help them use AI to create that real human communication experiences, where that's actually supporting your families, those patients, or the entire community. We're actually creating tech that connects. Check it out, francis.ai. And you guys are doing great when you talk about what you guys are doing in mental health partnerships. Over 8,500 people served. I believe 70% of your team with lived experiences, which is not just stats that you told me, it's truly the movement you guys are making. How did that build a place where hope is the default?
Well, I mean, one obvious answer and reason is that people see among themselves others who have walked through, and have
Hmm.
gotten through, and gotten to the other side, positively managing their mental health conditions, and they're in recovery, and that gives people a lot of hope. That's what we do. And that's what our service
Yeah.
really is helping others understand journeys that have been taken, and that they, what can they do, and providing them the tools and supports to get into their own recovery journey. And
Is it?
when we started, we were Mental Health Association of Southeastern Pennsylvania. We had a name
Mhm.
change, but we were started by people with lived experience who refused to be thrown into institutions where they were languishing, and wanted to be in the community and have community supports for their mental health. And that's what we were able to achieve at Mental Health Association, now Mental Health Partnerships.
When I think about mental health partnerships, is there anything that will surprise people that you guys are doing in a good way that people may not know about?
Yes, I think many things, but let me just focus on a couple. So one is,
Okay.
20 plus years ago now, more than 20 years ago, we pioneered the certified peer specialist role within the mental health field. And medical assistance actually pays for it so that people can get a certified peer specialist. So we were responsible for that. But now we're talking about what is the career trajectory, and can we work with certified peer specialists who then can get in other positions in the mental health workforce, like therapist or psychiatrist, even,
Mm,
managers and leaders of mental health organizations. How can we support more people to make it to those roles? Because what we think is that if there's more people with lived experience providing services and leading in this field, that the service is going to be better because they understand so deeply. They've been there.
mm.
That's one thing. Another thing that we're working on that I'm really excited about because it touches more people is going to corporations and working with them to do trainings, changing their policies, but also training certified peer specialists right there in the workforce who can then support their colleagues. And so then we would support those certified peer specialists. So it really could change a culture, like a corporate culture, in how do we ensure that we support people with mental health conditions, but also make a healthier workforce because it's going to hit the bottom line. People, call out less, there's not as much turnover, there's more productivity. So I think, there's definitely a business case for it, and we're going to be piloting it. We just started.
I love it. What is your role, Jeannine, and with mental health partnerships?
I'm president and CEO. So the
Okay,
C
just
suite reports to me, and some vice presidents and directors. Um, and yeah, I have the scope of the whole organization. So when you're a leader of the whole, at times you're called to go a little bit into the trenches, and do
yeah.
some work when there's gaps or when there's complex issues so that you can disentangle that. And then, at other times you're called to do higher level things, be a spokesperson, form relationships with donors, and be out in the community. So it's also strategic planning and making
Yeah.
sure that our business model is strong in every different program so that we're sustainable and we can continue to grow. Because in order to do the work we do, which is very complicated, we really do need to be strong in our infrastructure. And I've been there now a year at Mental Health Partnerships, and I've been working intensively on all those things, and we've seen amazing success in that time. It produces a lot of hope inside the
Yeah.
organization.
I love it. I love it. I love how you said there's time that we have to get back to the trenches. As a leader, we play all roles. We pick up where some may slack, but we also help others find their talents. We find where people are best fit, right? So sometimes you have to kind of work alongside people to figure that out. And it looks like you've never shied away from working the front line, right? Early on in your career, you worked a lot of the front line. I mean, picking up the phone calls, that's kind of the hardest, probably line of work that someone can do is pick up those calls and hear these stories and not get emotional or not take them. But I think you said something that resonated with me. You said recovery is possible for everyone, even when the system gives up. Can you take us inside of a moment when you saw the truth truly unfold like that?
I can, something just popped in my mind. I hope it's relevant, but I feel I have to tell about it. Is I was working for Project Home for 10 years as vice president of program operations, and I would always go to the programs or go out and shadow the people doing the work because I learned so much, right? And so one night I was on street outreach with the outreach team that oversees all of Philadelphia's street outreach, and we came into an alleyway that was outside of a shelter, a men's shelter, and they called us there. They called us out because the prisons had dropped off a man who must have been about 80 pounds with dying of AIDS and literally could not walk. Now there was steps to get in the shelter. He could not get up the steps, although the prison had had tied a 2x4 to his legs in order to like shore him up. So it was really an unbelievable sight. And at the time, I called the ambulance. The ambulance came. They had been there before and they denied the person. They came and we kind of had it out in the street. They also denied the person. So then I had to elevate it with the city. Long story short, this person was able to get into hospice care, reunite with his family, and when he passed, he was with his family. So is that a story
Wow.
of recovery? No, but it's a story of healing and redemption before he went to pass, that he was back with his family and that he
Hmm.
was safe, and that he experienced that love in those relationships. And
And Janine, you continue to fight. You continue to push back on policies, systems, even power structures. Uh, what's a moment you chose principle over comfort? Was that a good example of that? And what did it cost you? If you have another example.
I would just say like always, principle. I always choose the principle. So I mean, small examples is whatever opportunity I get to meet with legislators or to give testimony, regardless of if it's tomorrow and now I have to stay up late writing a speech. I'm going to do it. I'm not going to lose any of those opportunities
Hmm.
because my job is to amplify voices that have been silenced, people who have been oppressed, been tossed away, and thrown out in a society that's incredibly rich. And I think right now we have an example of that going on in our culture where the federal budget, they're getting ready to cut Medicaid, and millions and millions of people are going to lose their health insurance. Why? So that the richest people in our country can get tax cuts. And, as a middle class person, that is incredibly offensive to me that my taxes are going to stay the same while they go to the rich and while I get to see more people dying on the street because that's what's going to happen. And so
Hmm.
right now we're in lots of advocacy at the federal level. This morning I was in a meeting with a staff person of a U.S. senator because the Senate is now meeting on this budget, and it's just incredibly critical that people's voices don't get lost. And in that meeting, I was able to elevate what we see at the street level and the realities of what they're talking about. Because, they say, oh, well, we have an exemption of the work requirement for people with mental health and substance abuse. But the bottom line is, how are they even going to produce the paperwork? If you're homeless and don't have a house, that alone will
Hmm.
get you cut off the rolls. So I don't think the exemption is really accessible to everybody. And there's a lot of other major problems.
You've been fighting your whole life, Janine. Fighting your whole life, right? I want to go back to the 15-year-old girl. If that 15-year-old girl was to see who Janine becomes today, what do you think she says?
Hmm. I have more like advice for her than I don't. I
Let's
don't
hear it.
know.
Let's hear it. What's the advice? What's the
I don't
advice?
know what she would say, but my advice to her would be recognize your worth, right now when you're this
Yeah,
young,
yeah.
traumatized girl, and
Recognize your worth.
hold that out. Like I think I would have wanted to know that, but I didn't at that age, and nobody taught me that.
No, not at all. I kind of go back and I share the stories that I think at some point our confidence was stripped away from us. And we had to learn our confidence, our worth, our value. I think we had to learn that. And even though I think we had it, we couldn't tap into it because we didn't even know what that looked like. And but we're in spaces now that we walk with confidence and we see people for who they are and we're uplifting. And I just think about, man, you've been fighting your whole life, and here you are still fighting because you realize that life is not even about us anymore. It's about those that come after us. It's about our kids. It's about people that we meet in the streets, as you mentioned, that they need that second chance. And you're a believer in second chances, aren't you?
Absolutely, yes.
Yeah. Yeah.
Absolutely.
Me too.
And you know what? It's a slippery slope because as soon as you
Mhm.
try to point and say them, those people, you're just
Yeah.
about a hair and a breath away from it, you know? And I can say that even when when I was diagnosed with end stage cancer, I had just moved to the Baltimore area and I didn't have a job and no health insurance. And guess what? I was a person who, if I didn't get medical assistance at that point, they would not have given me that bone marrow transplant and I wouldn't be talking to you right now. At the last minute I got it. But, it's not them, it's all of us. Like
Yeah.
nobody is immune from what the world can deal out and what can occur
Yeah.
to you.
I love it. I love that what we're sharing here because so many people probably feel alone or feel like there's no light at the end of the tunnel, but we're both testimonies of that there's light at the end of the tunnel. That you might be in a dark moment today, but one, there's resources. There's resources such as your organization. There's leaders out there that truly care to make a difference. Not so much about a paycheck. I think but things I've been saying lately is that people like yourself, you don't chase a paycheck. You chase purpose. You chase passion. 'Cause let's be honest, Janine, you could be working somewhere else making a lot more money, but it's not about the money for you. Never has been. Right. It was always about how do you uplift others, and I really love that you're in that space. I ask you, we talk about the cuts that are happening at the government level. I see that organizations, and not just only nonprofits, that you mentioned the healthcare. I mean, people personally that are scared to go to a doctor because they don't know if they're going to be taken away from their families. Right. Like that's where we're living at in this time of day. But when it comes to the sense of the nonprofit, where we are having to cut maybe programs or cut people, are we implementing AI to try to fill that void? Is your organization looking towards that? And
I
if so,
think
what kind of AI tools?
Yeah, and actually, that's something we're working on now. We just finished a strategic technology plan, and so
Hmm.
one of the things we're focused on is what is our AI protocol. How do we want to utilize it? But I know that the leadership team uses it in various ways to have more speed in the clunky things we have to do,
Yeah.
especially analysis and
Hmm.
that type of planning. It has saved a lot of time for us, but
Yeah.
we're going to be doing more. We just need to lay it out. And as I said, there was a lot of infrastructure things that I've been working on since I came.
No, I believe it. I believe that even in the healthcare, when I talked about healthcare, pandemic happened, we lost so many people in the healthcare industry, and I believe, and I'm hearing from other leaders, is that people had to do the things they didn't want to do and were not happy about. So they found other careers, maybe doing their own things. And it's that admin work, it's that busy work that we don't love doing. We love to help people, and we get taken away from that. It doesn't become enjoying anymore, right? So we can find tools that help us save time, as you mentioned, save time doing the little things that just doesn't really make sense to us because we want to be on the front line. Like, yeah, let's implement those things. And how do we even implement AI to continue to communicate with our communities? Like, there's so many different tools, as you mentioned. It's having to find that right partner, that right tool. But I love that you guys are in it, thinking strategic, because there is a lot of organizations that are already kind of rolling it out, already implemented these things. And AI to me is almost like the social media. When people say that when I remember the first thing, MySpace. Remember MySpace
Oh
days?
yeah.
Now we're on Facebook. Now we're on Instagram. Now we're on TikTok. Like it's really evolved. I mean, the computer has evolved, and thinking that AI has truly been here for some time, as in text predictive, predictions, but we haven't called it AI. So I love that you guys are thinking about how do we continue to move with the times,
Hmm.
and help us become better versions of ourselves, but also help us do what we love more and let the AI automation take care of the things that we can just automate in a sense, right? So
Absolutely. I
I
think
think it's cool.
you've done a good job of that just from my little interface with how you work, and I really liked that.
Oh man, yeah, 100%. What's crazy is that 3 years ago I had a friend tell me about ChatGPT, and like probably everybody else, I'm like, oh, that's cool. Never really used it. I would tell people about it, but never use it myself. And within the last, I would say, year and a half, I mean, it becomes my personal assistant.
Yeah.
And working on automation, and these are the things I didn't even never knew, but I had to learn, and I see the benefit of it and the time that is being saved. So I always love to also spread that to the nonprofits.
Mhm.
If someone is listening right now, Jeannine, but they're barely holding on, what would you want them to hear from you today?
Something that you said earlier, you said life is like a roller coaster. Every day is different. So, first and foremost, recognize that tomorrow is a new day. You're not going to
Hmm.
feel the way you feel today. You'll feel differently. And I really
Yeah.
want people to hear that who might be considering suicide, taking their own life, to realize it's not the end of your story. And there are many, many people here to listen to you. One, most importantly, you can call 988. It's a crisis
Hmm.
line that is always answered, and people will work with you. At Mental Health Partnerships, if you go to our website, which is mhphope.org, you can get a
Hmm.
chat line and you can literally chat with somebody right away. You can also call in to get support, and we'll be able to route you to a program that could help you. We have certified peer specialists that could work with people, case managers. We have recovery learning centers where people can just drop in and immediately get support. So there, it's an easy entry. It's not like trying to sign up to get a psychiatrist, which could take 6 months. We have something for you today, and we can walk with you through your journey.
Janine, I've truly enjoyed this conversation, and it's time that we put you in the hot seat. We have that blind question from the last leader that we want to ask you.
Okay, great.
Thank you so much for all the insight. Thank you for what you guys are doing at the organization. And I know at you at the helm that there's so much growth that's about to happen because of who you are and what you bring to the table. So, first of all, I just want to say thank you for your time.
Thank you.
Um, yeah, of course. The blind question for our last leader is what's one core belief that's been true since the beginning and still guides you now, even when no one's watching?
The core belief is the dignity and the worth and the value, the sacredness of every individual.
So good. So good. So easy. That just came to you so easy, Janine. What
One,
is your blind question to the next leader?
my blind question is, what advice would you give the next generation of leaders?
Okay.
I think
All right.
that's
I
really
love it.
important, especially for the nonprofits, because we need to make sure we're developing leaders. It's really easy to lose leadership to corporations where they can make more money. So, how
Yeah.
are we cultivating that next generation?
I'll tell you what, I lead a nonprofit that's attached to a high school. And I always ask, are we talking about this at the high school level? We talk about going to be a doctor or a nurse, but are we talking about becoming a nonprofit leader where you could truly make big impact? Because what we mentioned is not always chasing the big paycheck. Because even when people make all the money in the world, they're still not happy.
Yeah.
But I tell you what, there's judges, there's people like yourself that have left different careers to get into the nonprofit space, and would always share how happy you are because you every day you're really making a difference in this world. And I don't know that we're speaking at it at the level we should be, which is our high schools and as our middle schools, is how do we continue to share that message at that level? So that's just my thoughts as I continue to work in the schools because I didn't know a nonprofit existed and what that it does, but now that I'm in it, I'm like, man, this is so cool,
Yeah,
you
that's
know? So,
important for us to get the message to young people. And
yeah,
I think along with it is a message of, financially, how do they set their life up if they want to do it? Because,
true,
we're
true,
living in an
true.
expensive world.
Yeah, we are. I
You
got to
might
work two,
feel,
three jobs.
I fear that we're going to have to pay to take a breath. I mean, when does that come?
Well, Janine, it's truly been a pleasure. Thank you so much for joining us here on the Hard and Hustle podcast. I can't wait to do this again because I'm pretty sure there's so much that's happening in the next couple of years and how you continue to scale up this organization. But thank you so much, guys. If you're still watching, make sure you guys do like, comment, and subscribe. But Janine, can you tell us, are you on social? What website? How can we connect with the organization?
Yes, we are on Facebook, we're on Instagram, we're on LinkedIn, we're on YouTube, and you could go to mhphope.org for our website, and you'll find everything there.
Well, I appreciate it. Guys, if you guys are still watching, don't forget to tag another leader that could really take all the insight that we've dropped here today. Miss Jeannine's always dropping gems. We thank her. Don't forget to subscribe. This has been Efrain. We'll catch you guys on the next one. Laters.